Welcome to the Modern AT. This video reviews anatomical position and directional terms, which are the foundations for clear communication in athletic training, kinesiology, rehabilitation, and sports medicine. Our objectives are to define anatomical position, use core and additional directional terms correctly, relate planes and axes to movement, and apply this terminology in clinical contexts. Precise terminology is vital for safety, clarity, and consistency. It improves evaluation, documentation, patient education, and team communication. For example, use medial joint line of the right knee instead of inside of the knee for precision. Anatomical position is the universal reference: body upright, facing forward, arms at sides with palms forward, and feet flat. All directional terms are interpreted from this standard posture, even if the athlete is moving or lying down. The core directional pairs are superior-inferior, anterior-posterior, and medial-lateral. These terms describe the position of one structure relative to another. For instance, the sternum is anterior to the scapula, and the great toe is medial to the fifth toe. Additional terms like proximal distal, superficial deep, and ipsilateral contralateral further enhance precision. They describe limb position, tissue depth, and sidedness, making your clinical documentation more specific. Anatomical planes and axes describe movement. The sagittal plane handles flexion and extension. The frontal plane handles abduction and adduction. The transverse plane relates to rotation. Combining these systems gives a complete movement analysis. In practice, use these terms during evaluation to locate symptoms precisely, in documentation for clear records, and for patient education. Aim for phrases like tenderness along the medial joint line to improve clinical communication. Apply these terms to realistic cases. For knee pain, identify the medial aspect. For shoulder symptoms, use anterior shoulder pain that radiates distally. Use side, region, and relationship, such as left posterior calf tightness. Review the directional pairs: superior-inferior, anterior-posterior, medial-lateral, proximal-distal, superficial-deep, and ipsilateral-contralateral. Practice using clinical examples to solidify your understanding and communication. Use this language for sideline evaluation, rehab cueing, and documentation handoff. Follow the best practice checklist. State the side first, then the region, and finally the relationship for maximum clarity. Avoid common mistakes, such as using vague words or confusing terms like medial and lateral. Ensure you always identify the side, region, and anatomical relationship. Your goal is to be specific enough that others can visualize the exact location. The key takeaways are that anatomical position is the reference point. Core and additional terms add precision, and planes, axes link vocabulary to movement. Accurate terminology improves all aspects of clinical care. If your description is specific, you are communicating well. These selected references represent reliable sources for anatomical and clinical knowledge. Continuing to study how these terms are used in various texts will strengthen your proficiency. Thank you for viewing this video.